In this video, we would like to introduce you to the FDI's Disease Profile tool. The tool is designed to help both clinicians and patients manage and monitor their periodontal disease as effectively as possible. The purpose of this video is to show you around the tool and demonstrate how to use it. If you have any questions after watching the video, please email info@fdiworlddental.org. The Disease Profile tool can be used anonymously, or you can create an account. The main benefit of creating an account is that clinicians can monitor the changes in their patient's disease profile over time, use the recall reminder function, and record the treatment steps which have been completed. Translations are available in Spanish, Portuguese, French, German, Dutch, Italian, and simplified Chinese. You can change language by clicking on the selection menu at the top right of the screen. When ready to create an account, you simply need to navigate to the login button and then register using your details. No identifiable patient data is recorded. You can then log into the tool on any visits in the future to access your account. Now you have created an account and are logged in, you're ready to start the questionnaire. Click Start Questionnaire to begin. You will then be shown a series of questions that you will be required to answer. You will need to specify the patient's age, whether they smoke or not, if they have diabetes, have they experienced tooth loss to periodontal disease, do they have heavy plaque, do they experience bleeding on probing, and what is their probing depth. The probing depth answers have an information button next to them. When you click on these, you can find out more about the periodontal parameters. Once you have answered all of the questions, click Finish. You will then be shown the answers based on the patient data you supplied. The answers provided will give a disease profile of mild, moderate, or severe. Low scores may indicate periodontal health. This would be determined by clinical examination. Treatment Goals outlines what we want to achieve for that level of periodontal disease. These steps are in line with new European Federation of Periodontology S3 Level Clinical Practice Guidelines, which approach the treatment of periodontitis using a pre-established stepwise approach to therapy. Click on the Information button to find out what treatment should be carried out at each step. Clicking the square beside the recommended treatment will record that the treatment was carried out. Clicking on Prevention and Maintenance will show when the next recommended recall is due and what treatment should be carried out for maintaining periodontal health. Each download will provide resources for the clinician as well as the patient. The downloads are provided in the appropriate language selected. Risk Factors provides a quick reminder for the clinician on healthy lifestyle choices to discuss with each patient. Oral Health Instructions, OHIs, will give a patient information leaflet according to their disease profile on how to manage their gum condition at home. Scorecard will give a reminder of the questionnaire answers from that appointment and disease profile. Now we've had a look at the downloads, we're going to go back to the questionnaire results. Clicking Edit will allow the clinician to change the answers on the questionnaire if necessary. For example, you can explain and demonstrate to a patient how if they stopped smoking, their disease profile score and risk factor would drop. We're now going to have a look at setting up a recall reminder. This feature is only available for registered users. Select Set up Recall Reminder. The system will then automatically enter the recommended date for the disease profile. However, this should be adjusted according to the patient's dental exam on the day. For example, if they have lots of inflammation and need to be recalled earlier, the date will need to be manually adjusted. If you need to change the date, simply click on the calendar and select the new date. Then click Save. Only the clinician's email address should be used for recall reminders. Save the assessments. Click on Generate New Patient ID if the patient has never been reviewed using the Disease Profile tool before. The clinician needs to keep a record of the patient ID. Please note that no identifiable records are stored in this program. Unclick Generate New Patient ID to recall a previously entered patient record. When you click Save, the new patient will show at the top of the page. By clicking on the relevant patient, you can open their file and review the patient's data. You can also delete patient data on this screen. To identify a previous patient, navigate to My Profile and click on My Assessments from the drop-down menu. On the patient assessment page, the top box shows how the patient's disease profile has evolved over time. You can view the answers to the questions at their last appointment, as well as what treatment was carried out. You can also download the patient information sheets from here. Once patient records have been entered, saved, and a recall date is saved, upcoming records are accessible through My Profile, My Reminders. The patient number or recall date can be selected to bring up that patient's previous record. Next, we're going to take a look at how to manage your profile. To view your profile, simply click on My Profile. Here, you can review all previous patient files, download all patient data, edit your profile, or delete your profile. To view your assessments, simply click on My Assessments. Here, clinicians can download all of the patient data they have entered so far. This allows them to monitor patient recalls and patient disease levels. You can click on Download all patient data to export an Excel file that you can save locally. Once a clinician has completed 5 assessments, a feedback questionnaire will pop up, which will ask a series of 5 questions. The answers are used to help with future development of the disease profile tool. To summarise, the FDI Disease Profile tool enables a quick and easy way to understand your patient's periodontal condition, risk for future periodontal disease, and provides an assistant to treatment planning. The tool also contains helpful downloads to inform your patients about their periodontal condition and how to manage it at home between professional visits. When used long-term, the FDI Disease Profile tool can help monitor your patient's disease over time and provide incentives in reduced disease profile score for the patients. Thank you for watching this video. If you have any questions, please email info@fdiworlddental.org.